What's up, Mariners? This is Mr. Tani. I'm back making another video. I have two doctors here from the residency program at Natividad, Dr. Sylvia and Dr. Jordan, and we're going to go through some questions and provide you with some information that might support in guiding you in these next coming weeks with the shelter in place.
I am Jacqueline Sylvia, and I am a second-year resident at Natividad Medical Center, which is a community hospital over in Salinas, not too far away from you guys. And my role there is to learn and train to become a family physician, which is the type of doctor that often sees you when you go see the doctor if you're feeling sick or if you're gonna get your shots and things like that.
Hi, my name is Adrian Jordan. I'm also a second-year resident at Natividad. Family medicine residency. So family medicine, it's a type of medicine where we treat people of all ages and treat people with any medical condition. And a resident means that we graduated medical school as a doctor, but are still doing more training in our specialty.
Yeah, I think that probably how many people are feeling, and maybe people that are listening, some days I feel scared when I listen to the news or I'm in the hospital. Sometimes I think that it's kind of a scary thing that's going on. We're hearing a lot of sad stories, and that's a lot of what's all over social media, and people kind of really worried. And so sometimes that's how I feel. But I feel really encouraged and really hopeful because the medical and scientific community is learning so much about COVID-19 every day. And so I think it's a privilege to be a part of the medical community during this really crazy time.
So I feel fortunate that so far we've avoided the surge in Monterey County, thanks to people staying at home and practicing good hygiene. But then I'm anxious as well because we still can't accurately predict how many people are going to become infected. And on a personal note, there's some anxiety about family members. My grandmother's 87. So mixed feelings.
We're straight back to you, Dr. Jordan. What are some signs and symptoms that our teenagers at Marina High School and their family members should look out for in regards to COVID-19?
Mm-hmm. So that's a good question. So there are a few symptoms that are particularly common with this disease: a fever, a cough, and feeling short of breath. And then as the disease progresses and people are getting sicker, some signs that you really want to watch out for, and signs that mean that you need to go to the hospital to get checked out. If somebody's having trouble breathing, if they're having pressure or pain in their chest, if they're feeling confused or drowsy, or if you see that their lips or their face are becoming blue. But for the vast majority of people, they will have much milder symptoms, and it's important to remember that you might not even know that you have COVID-19 because your symptoms might be so mild, but it's still important to, because you can still pass the disease on even when you don't have any symptoms.
Dr. Sylvia, can you offer any, so on the news, we're always hearing, and we're hearing it on the news and on the radio, wash your hands, wash your hands, wash your hands. Are there any tips or tricks or recommendations you can provide for the people watching this video when they're washing their hands?
Yeah, so I think that this is such an important question because the virus spreads a couple of different ways, we think, but the number one way that it spreads is in through your orifices in your face, so your eyes and your nose and your mouth. And usually the way that it spreads is from your hands to your eyes, your nose, and your mouth. And so it's so important to wash your hands. It's one of the best ways that we can help prevent the disease from spreading, along with our sheltering in place. So the way that we recommend washing your hands is 20 seconds long, so it's kind of a long time. Some people sing the ABCs or some 20-second blurb of a song. And the important thing is to get underneath your fingernails, to get on the front and the backs of your hands and in between your fingers, and then all the way up to your wrists. And really, it's important to try to do it every time if you're going outside to walk your dog or play with your kids or anything like that for the parents, to do it every time you're touching something new.
All right, Dr. Jordan. So we are currently on a shelter in place in California. We've been on a shelter in place for a few weeks, and we have weeks to come of the shelter in place. Are there any recommendations you might offer to the people viewing this video, or any tips for them to stay healthy while they're sheltering in place?
So when people are sheltering in place, they have a lot more time to themselves at home. So it's important to develop some kind of routine that can help you get through that. Schedule some time in the day for learning, schedule some time in the day for exercise. You can even do some YouTube videos, follow some YouTube videos online, and schedule some time in the day to keep in contact with your friends, people that you trust, people you can talk to. We're fortunate that we have a lot of social media now, that we can contact people who we can't physically see, but we can get in contact with them through our phones or online.
Dr. Sylvia, I'm coming back to you for another question. A lot of young people right now and a lot of families in our community are feeling really anxious. And so I'd love to hear from a medical professional what your thoughts are on people who right now are experiencing some heightened anxiety.
Yeah, I think that this is a really normal feeling for people to feel right now, and I completely empathize with it because I feel anxious sometimes as well. And almost all the patients that I've been seeing in my own personal clinic have been complaining or concerned with anxiety. So I think that it's completely reasonable, and I would love to offer some tips and tricks that I've been trying to use and tell other people about, so that you can help with anxiety, because it's such a high, stress time. And some of those are, and kids can relay this to their parents as well, to choose one time of day to listen to the news, not to have the news playing in the background at home on the TV, or to be checking, the news online every couple minutes. Really important to try to limit yourself and kind of know what your limitations are and what triggers you, and really making sure that you're getting your news from a reliable source. The most reliable source that we have right now is the CDC, but not relying on people on social media that are panicking or having, anxiety themselves, because sometimes that can be translated a little bit differently. And a few other ones are just to really try to find time to relax, and whether that's in the form of meditation or just like really zenning it out. There's a bunch of apps online right now that are offering free trials, like Headspace, Calm, Stop, Breathe, Think, Relax Remedies. And now that we're home and have all this extra time, you could actually incorporate that into your day and really try to, bring your heart rate down and try to find some space for yourself. And the last one that I'll offer, which I think may be one of the most important ones for especially this generation of teenagers who all have cell phones and social media and stuff, is really to try not to be a contributor. And I guess what I mean by that is not putting up inflammatory remarks online about COVID. I think it really just keeps the ball rolling on people's anxiety. And even though sometimes memes and stuff are meant to be funny, some people are really reacting and having anxiety to that. So just to be really careful about what you're saying and what you're putting out into the environment while everybody's stressed out right now.
So a couple of things. So one thing that's positive is that the vast majority of younger people who get this disease don't become severely sick. But it's still important to prevent the spread by staying at home, washing your hands. The second thing is that the shelter in place seems to be working so far. We've had very few cases in the hospitals in Monterey County compared to some other places, so we're doing a good job. And then the third thing is that this virus, it's very scary, it can make people very sick, but it has one real weakness, and that's that it can't travel 7 feet. So as long as we're mindful of that, I think that we should be able to prevent it from spreading.
Thank you, Dr. Jordan and Dr. Sylvia.
Yeah, I agree with all the things that Dr. Jordan said. I would just add, I really want to empathize with high schoolers, even though it wasn't recent. I remember being in high school and all the things that you want to look forward to that everybody's kind of feels maybe like they're missing out on right now. And really just to, encourage them and let them know that we're all here and supporting them, and hopefully they know that they're, you know, still really important part of our community and doing such a great job. And the other thing I would just offer is that there's a lot of things that can happen when people are home for an extended period of time. You know, a lot of people aren't working right now. People are struggling with food and being at home with people that may not be safe. And I just want to offer that you wouldn't be alone if you were feeling that way. And if you are feeling that way, I would just recommend, you know, reaching out to you, Mr. Tani, someone at school that you feel safe with. You can call the doctor. You can call 211. That's a line that Monterey County has that can help people that are in a crisis and answer any questions. And of course, 911. But yeah, just to stay safe and know that we're thinking of you guys.
Right on. Thank you both for offering those last comments there. And on behalf of Marina High School and on behalf of our community, our administrative team, our teaching team, our support staff team, and our young people, our scholars, I thank you both for your words of wisdom and, you know, the effort that you guys are putting forward at the hospital to keep our entire community safe. So thank you for what you guys are doing.